Coming up next on C-SPAN, a 30-minute program sponsored by the Close-Up Foundation concerning the high costs of healthcare.
Even after decades, there's still one issue the U.S. hasn't solved yet.
I'm Dr. Robert Valdez, and I serve as the director of the Agency for Healthcare Research and Quality.
I'm Melinda Bunton. I'm a health economist and professor at Johns Hopkins University.
My name's Nate Apathy. I am an assistant professor at the University of Maryland in the School of Public Health.
Healthcare in the U.S. affects everyone, from individuals weighed down by medical debt to patients struggling to cut through layers of red tape from insurance companies. Despite spending more on healthcare than any other country, millions still ask, why are costs so high? First, we talked to Dr. Gui Fang, a scientist and program director at NIH.
I think the main reason for increased health costs, I think one is, especially like discover the new drugs, medication, so expensive. So from one new drug developing probably take more than 10 years.
Another factor is that a lot of the spending that we do in the United States on healthcare is not directly on doesn't get spent on the things that actually improve people's health. It gets spent on a lot of administrative and sort of what a lot of people would call wasteful things, like making sure that, this insurance bill gets formatted in the right way and sent to the right insurance company. Like, all of that stuff is costly, but none of it makes anyone any healthier.
Healthcare in America is a paradox. We have some of the world's most advanced treatments and cutting-edge innovations, yet millions of people struggle to afford or access even basic care. At the center of this crisis is a broken system of private insurance and rising healthcare costs. So, how does private health insurance work? In the U.S., healthcare is a complex web of private insurers, government programs, and healthcare providers. Patients rarely pay their medical bills directly. Instead, insurance companies, including private payers like United Healthcare and government programs like Medicare and Medicaid, act as intermediaries. These payers negotiate prices with hospitals and doctors, deciding what's covered and how much they'll pay. What's interesting is that while U.S. public healthcare spending is on par with other developed nations, it is the private sector that accounts for these significant costs. Administrative overhead, complex billing processes, and inflated prices negotiated by insurers drive these expenses. This fragmented system often prioritizes profits, leaving patients to navigate costly and inefficient care. Americans spend way more on healthcare compared to people from other countries. And no, it's not because Americans consume more healthcare than others. Instead, we pay significantly more for every service. Whether it's a routine doctor's visit, a hospital stay, or prescription medications. For example, an MRI in the US can cost upwards of $1,000, while the same scan in Japan might cost $100.
Almost all types of services, whether those are professional services like the services of doctors or nurses, or for drugs, devices, or things like hospital stays, we pay a lot more per unit of care, if you will, than they do in other countries.
These inflated prices are results of a fragmented system where providers, insurers, and pharmaceutical companies set rates without meaningful oversight. These exorbitant costs can be seen in the Iron Triangle. Healthcare systems are defined by the Iron Triangle: 3 key pillars: quality, cost, and access. Improving one affects the other. One reason access is lower in the US is because of prior authorization. Prior authorization is a cost control process requiring healthcare providers to obtain approval from insurers before delivering specific treatments or services. Alarmingly, 1 in 4 doctors report that these delays have led to serious or life-threatening medical issues for their patients.
I had a patient, she had a history of breast cancer. She had a double mastectomy. Several years later, she started getting pain in her chest, and the appropriate test for her, unquestionably, was a CT scan. I ordered the test. It was denied by her health insurance company. It was a delay until she actually got the test she needed. It showed a recurrence of cancer, and the patient later died. This is a stark example, but not an uncommon example of what happens.
We need policies that expand affordable private insurance, reform prior authorizations, and lower drug costs through efficient manufacturing and pricing transparency. While progress is being made in America's healthcare industry, it's not enough.